Assalamualaikum warahmatullahi wabarakatuh. I am Siti Nurani Zahani binti Zarlan Kadri. I had undergo my clinical training at Klinik Kesihatan Kuala Berang. So this is my case study presentation. The first one is stunted child and the second one is delusional anemia in pregnant women. I will start with my first case study, which is stunted child. Here is the table of content. For the introduction, Ideal, which is not a real name, is a 2 years old Malay boy. He lives in Kampung Tuk Randuk, Kuala Berang, Terengganu with his parents and other siblings. He had a sedentary physical activity as claimed by his caregiver. Both of his parents are working and did not consume alcohol or smoking. Ideal did not yet go to kindergarten, however, he was sent to a babysitter when his parents out for work. For the case chronology, he was referred to the nutritionist on 7th January 2021 for nutrition counseling or education for the mother. During this time, the boy age was 1 year and 9 months old, with the weight of 10.5 kg and 80.0 cm height. On 14th March 2022, he met a nutritionist at the age of 2 years old. During this meeting, his weight was 10.9 kg with the height of 80.5 cm. The increment of his height was only 0.5 cm for 3 months. He did not meet the growth standard based on the WHO Child Growth Chart of height for age and was referred to the nutritionist due to stunting. From the 24-hour diet recall, it can be observed that Ideal need to eat 5 meals a day regularly, consume adequate intake of nutrient in daily diet, and increase the intake of fruits, vegetables, and fiber-rich milk. The next TCA for Ideals is depend on the appointment in May. Next, for the medical diagnosis, malnutrition refers to energy or nutrient deficit, which is undernutrition, excess, which is overnutrition, or imbalances in person daily intake. These include physical conditions such as underweight, stunting, and wasted. In this case, Ideal was categorized as stunted since the age of 1 year and 6 months old due to the Z-score for height for age of less than -2 standard deviation. For the diet diagnosis relation, Ideal may had inadequate nutritional intake in daily diet due to low consumption of growth-promoting nutrient, inadequate intake of protein, and lack of micro and macronutrient intake. Next is the nutritional assessment and intervention. First, for the anthropometric assessment, his current weight was 10.9 kg with the height of 80.5 cm and BMI of 16.8 kg per meter squared, which indicate that he had a normal body mass index. He had the height for age of less than -2 standard deviation that indicate as stunted, while for weight for height, weight for age, and BMI for age as normal. Here is the dietary assessment based on the 24-hour diet recall. For the breakfast at 8 a.m., he took 1 scoop of fried rice with a glass of milk. Next, for morning tea at 10 a.m., he ate half whole apple with plain water, while for lunch at 2 p.m., he took 2 scoops of white rice with 1 piece of chicken with coconut milk, half cup of carrot, and a glass of milk. For afternoon tea at 5 p.m., he ate a piece of fried spring roll with plain water. For dinner at 7 p.m., he ate half scoops of white rice, eaten with a piece of fried chicken and plain water. For supper at 10 p.m., he ate half piece of white bread with green tea. Based on the dietary assessment, it can be seen that Ideal eating at regular meal time, he is not a fussy eater, and he still consumes breast milk. He had an inadequate intake of variety, micro and micronutrients essential for growth and development, thus lead to stunting, which is low height for age. The nutrition diagnosis for this case study is stunted related to lack of nutrient intake as evidenced by a Z-score lower than -2 standard deviation for height for age based on WHO Child Growth Chart. The goal is to achieve a normal Z-score for height for age, while the principle is eat 5 meals a day and have an adequate nutrient intake in daily diet. The second goal is to achieve an adequate intake of nutrient for growth and development. The principle is by consume 3 servings of vegetables daily, take fruits for snacking, and consume 3 servings of milk daily. This is the estimated energy requirement. Based on the Peterson equation, the energy requirement for ideal is 945 kilocalories per day, while for recommendation of energy requirement according to RNI 2017 for child aged 2 years old is 980 kilocalories per day. The range of energy requirement is 945 kilocalories per day to 980 kilocalories per day. Thus, the energy intake recommended is 970 kilocalories per day. Here is the estimated macronutrient distribution based on 55% carbohydrate, 15% protein, and 30% fat. Thus, it is recommended for ideal to take 4 exchange of carbohydrate, 2 exchange of protein, and 1 exchange of fats daily. Here is the menu planning for weekday 1, the menu planning for weekday 2, and the menu planning for weekend. For monitoring, this section does not apply to this study since PSP is not monitoring this case. This case study was given on the RCP, which is Runding Cara Pemakanan Day. As for the conclusion for this case study, ideal is categorized as stunted. The dietary management plan includes giving variety and diverse diet, which include breastfeed, food from plant sources such as fruit, vegetables and staples, and most processed foods such as meat, fish, egg and dairy, and fortified foods. All essential nutrients was included in the plan to overcome the problem. Parents and caregivers playing an important role in monitoring the diet intake of child. The second case study is situational anemia in pregnancy. Here is the table of contact. So for the introduction, Mrs. E is a 30 years old Malay female who lives in Kampung Kuala Pueh, Kuala Berang, Terengganu. Her gestational age was 28 weeks 2 days. For the past medical history, he had less HB level of 9.8 gram per DL. The medication is Zincofer and Ferrous tablets. She is a full-time housewife and graduated from secondary school. She did not consume alcohol and smoking and lived with her husband. She is self-employed. For the case chronology, on 8th March 2022, she was referred to a nutritionist for anemia management. At that time, her gestational age was 24th week, with HB level of 10.1 gram per deciliter, which indicate mild anemia. On 7th April 2022, he met the nutritionist for a new case. During that time, her gestational age was 28 weeks, with the HB level of 9.8 gram per deciliter, which also indicate mild anemia. From the 24-hour diet recall, the nutrition counseling was done. First is to increase intake of heme and non-heme iron-based food. Second, drink juices, fruits and vegetables with high vitamin C to increase iron absorption. And third, to avoid caffeinated foods drink. This is the last appointment and there is no TCA. Next, for the medical diagnosis, anemia occurs when the quantity of red blood cell or the concentration of hemoglobin within them is lower than normal level. The symptom includes fatigue, weakness, hair falling out easily, dizziness, short of breath, and spoon-shaped meals. There are 4 classifications of HB level, which is severe anemia with low than 7 gram per deciliter, moderate anemia, which at the range of 7 to 9 gram deciliter, mild anemia, which is 9 to less than 11 gram per DL, and normal, which is more than 11 gram per DL. The antenatal screening for anemia is very important to help prevent poor maternal and perinatal outcomes. The biochemical tests to detect the anemia include full blood count tests and tested using hemoglobinometer, which is used if FBC is not available. The complication of anemia to the mother include miscarriage, bleeding during childbirth, susceptible to disease, poor heart function, and death, while to the baby, it may lead to stunted growth, low birth weight of less than 2.5 kg, premature birth, and death. Is the diet diagnosis relation. The insufficient iron stored in the body may due to the low consumption of protein from heme and non-heme iron food sources in daily diet and high intake of caffeinated drink which can reduce iron absorption. Next is the medication or drug. She was diagnosed with IDE at the 19th weeks of gestational. She was prescribed with zinc tablet 1 times per day and ferrous sulfate 1 times per day. You don't have any contraindication or adverse effect. During the 28th week, she continued with prescribed medication. This is the nutrition assessment and intervention. First, the anthropometry assessment. During the pre-pregnancy, Mrs. X's weight was 56 kg with height of 158 cm and body mass index of 22.4 kg per meter square, which indicate normal BMI. During the booking, her weight was 61.3 kg with the height of 158 cm and body mass index of 24.6 kg per meter square, which also indicate normal. Here is also her gestational weight gain from the 5th week of gestational until the current 28th week of gestational age. So next is the biochemical assessment. Here is the HB level and the MGTT test. So you can see here that the value of HB levels start to drop to less than 11 starting from the 19th week of gestational age, and the current value is 9.8 gram per deciliter, while for the MGTT test is normal. For the clinical assessment, Mrs. A has a blood pressure of 116 systolic and 75 diastolic, which indicate normal blood pressure. Here is the dietary assessment. So first, we can see the food checklist of heme and non-heme iron-based food. So here is the protein intake. You can see the intake of red meat, currant, chicken liver, and nuts. We can see that Mrs. A had a low intake of heme and non-heme iron-based food. He took only once a week of red meat, currant, and chicken liver, and he doesn't eat nuts. We also had the food checklist of fruits and vegetables of Mrs. A. Here we can see that she took an adequate intake of vegetables and fruits in her daily diet. So based on the dietary assessment, we can see that Mrs. A had an inadequate consumption of protein in daily diet. She only took heme iron fruit sources once in a week and had an adequate consumption of fruits and vegetables, and also regular consumption of caffeinated drink, which reduce iron absorption. The nutrition diagnosis for this case study is low hemoglobin levels related to pregnancy and reduction in iron intake as evidenced by a HB level of 9.8 gram per DL during the 28th week of pregnancy. The first goal of this case study is first to achieve a normal hemoglobin level of more than 11 gram per deciliter. The principle is to incorporate drink juice, fruits, and vegetables with high vitamin C content to enhance iron absorption and avoid caffeinated drink. The second goal is to increase the intake of heme and non-heme iron-based food. The principle of this goal is to increase intake from animal-based food such as meat and shellfish. Here is the estimated energy requirement. So we calculate the energy requirement by using quick method. The ideal body weight of Mrs. A is 56.2 kg and the adjusted body weight is 58.2 kg. The ideal weight range was 46.2 kg to 62.2 kg. So based on the quick method, we achieved the range of energy requirement of 1064 kilocalorie per day to 1455 kilocalorie per day. So the energy intake recommended is 106,080 kilocalorie per day. The addition of energy requirement during pregnancy based on RNI 2017. Next, we have the estimated macronutrient distribution based on 60% carbohydrate, 30% protein, and 20% fat. So, from the calculation, we got the 12 exchange of carbohydrate, 6 exchange of fat, and 6 exchange of protein, and 1 exchange of fat to be consumed daily for Mr. A. Thus, here is the weekday 1 menu planning, which include breakfast, morning tea, lunch, afternoon tea, dinner, and supper. Here is the recommended food intake. Next, for the nutrition monitoring and evaluation, this include 2 domains, which is anthropometry and biochemical. For anthropometry monitoring and evaluation is self-weighing every week to keep track on her weight and avoid excessive weight gain from the recommendation weight gain for pregnant women, while for the biochemical domain is to increase HB level to more than 11 gram per deciliter. There are various factors that commonly causes anemia during pregnancy, which include micronutrient deficiencies of iron, folate, and vitamin A, and also vitamin 12 and parasite infections. The iron supplementation adherence is crucial in preventing and treating iron deficiency anemia, especially in pregnant women. The adequate intake of protein and heme iron sources such as animal meat, fish, and shellfish especially is important to prevent the reduction of HB level. The high intake of caffeinated drink can inhibit the iron absorption. Thus, we need to change to fruit juice that high in vitamin C content. The conclusion for this case study is that Mrs. A was diagnosed with dilational anemia during her pregnancy with the HB level of less than 11 gram per deciliter, which is her hemoglobin level was only 9.8 gram per deciliter. The dietary management plan include a high amount of iron-rich food, especially food rich in heme iron, such as meat, fish, and shellfish, and also increase the intake of high vitamin C food to encourage iron absorption and avoid caffeinated drink. The adherence to the recommended diet may help to tackle this problem. That's all for my case study presentation. Thank you.